New Mom to Be is a study of cardiovascular risk during pregnancy. So it's the focus of the study is on maternal cardiovascular risk. And what we're doing here is something quite, was seen as quite new, and that is that, and this again came up out of a number of smaller studies, but the idea is this: do pregnant women snore? Yes. Maybe 10 to 20% of women begin snoring during pregnancy. And all of our information suggests that snoring is not a symbol of healthy sleep. Snoring indicates that there can be a possible difficulty breathing during sleep. And every time you struggle to take a breath, your body responds to this by elevating the stress hormone levels, the adrenaline levels. This elevates your blood pressure. It makes your heart work harder. It changes the demand for blood sugar. And so we're currently looking, and this has been studied in adults quite well, but it's never been looked at in pregnancy. And right now we're studying 10,000 women who are who enrolled having their first pregnancy, and we'll soon know whether sleep disordered breathing may be contributing to some of the cardiovascular and metabolic risk associated with gestation, gestational diabetes, preeclampsia, and whether these risks extend after pregnancy. In other words, the pregnancy ends, but does the risk of sleep disordered breathing and the cardiovascular effects go away? These are things that are all being studied now. We don't know the answers yet, but we're very hopeful. Why are we hopeful? Because, you know what, there's 4 or 6 million pregnancies a year in the United States. The rate of preeclampsia is quite significant, and gestational diabetes. If breathing is part of that problem, it can be treated.